Hey everybody, this is Dr. Lane here with Elemental Natural Medicine. I wanted to shoot this short video because I get a lot of questions about perimenopause, menopause, and postmenopause, particularly about what do I do, how do I balance my hormones naturally, how do I approach that phase of my life when we're going through a change. And so there's really 4 clinical priorities to building your healthy hormone house. And this is true for a man, a woman, a younger woman, an older woman, younger man, older man. So any age, man or woman, menopause, not in menopause, hysterectomy, no hysterectomy. There's just a foundation that we build a house on. And then for every individual we work with, we have to customize things a little bit. Okay, but the 4 priorities really start even in perimenopause or before menopause, because how we go into menopause will often dictate how we come out of menopause. So we can go in with smooth sailing, like if we're flying through the air and no clouds, smooth sailing, no turbulence. Usually you're going to be healthier in those situations going into menopause. You can also go into menopause with some thunder, some symptoms, some thunder and lightning, lots of symptoms, the hot flashing, the night sweating, all that. And then how we go in often dictates, as I mentioned, how we come out. So we want to focus on 4 things actually before we even get to menopause. So perimenopause is a starting point, but even before that. And we want to look at these 4 priorities when we talk about what affects our hormones. The first is your blood sugar. So you need to balance your BS, all right? Your blood sugar, because blood sugar imbalances are probably the number 1 cause for how your hormones start to get out of balance. If you're dysglycemic, you have dysfunctional blood sugar, irregular eating patterns, or you're diabetic on one end, or you're really low blood sugar on the other, a lot of people are doing a roller coaster, that instability starts to skew your hormone production. Women will start to produce more testosterone from their estrogen. Men will take their testosterone and convert it into estrogen because of blood sugar imbalances. The number 1 cause of infertility among young women is something called polycystic ovarian syndrome, PCOS, or PCOS for short. It's when insulin receptor sites develop on cysts. Cysts develop on your ovaries with insulin receptor sites. So PCOS is a blood sugar disorder, really, that starts with your diet and your lifestyle, which leads to infertility among younger women. So blood sugar is really important. I can't stress that enough. Balance your blood sugar. The second thing is your gut health. Your gut health you have to be healthy, because your hormones are made in your digestive tract. So if you have infections in the gut, or you have intestinal permeability known as leaky gut, which is a version of that, or you have other infections, or you're hypothyroid and you're not moving your bowels, that's a problem in order for you to make your hormones. So your gut health needs to be really where it needs to be. It needs to be healthy. Your liver is another component of this. Your liver has to be detoxing properly. A lot of people don't detox very well. And so what happens is metabolites, these hormone metabolites, meaning what's left over after you use your estrogen and after you use your testosterone, is toxic. It goes to the liver to get processed out of your body. Some people don't process very well. They don't detox very well, so they start to accumulate this toxicity, okay? So we want to make sure our liver is working well, and we want to make sure that we're feeding our body with what it needs to make our hormones. These are the essential fatty acids, the omega-3s. These are the building blocks in order to make our hormones. And so with a standard American diet, we're often not getting enough of these. We're getting a lot of omega-6s, which are very inflammatory. We need more omega-3s often, which are anti-inflammatory. And so that's a healthy house you can build your hormone house on. That's a good foundation. But then again, for every man and woman, we have to sometimes do something different. So if we've had hysterectomies, for example, we may have to supplement with some hormone, because if we're hormone deficient, you'll know the symptoms, right? The hot flashing, the night sweating, the breast tenderness. But also when you're hormone deficient, your body will atrophy. Your estrogen and your testosterone, they build tissue. They build brain tissue, they build joint tissue, they build muscle tissue. So if you're hormone deficient, it's more than just hot flashes and night sweats. The body actually starts to atrophy, and we don't want that either. So how your health is going into perimenopause often dictates menopause and postmenopause. So I would encourage you now to start looking at your health. And these are the great four priorities to focus on initially, because it's your diet and your lifestyle, it's your microbiome, your detox system, and your diet. Those all work together to stabilize you going into perimenopause. So if this resonates with you, or if you're curious to know more and you'd like to come in for a complimentary consultation, click on the link below and we'll get you set up for a complimentary consultation. I'm Dr. Lane with Elemental Natural Medicine.